Hello, everyone, and welcome into another episode of Ask the Doctor. Today we have with us Dr. Michael Hulse and Dr. Mohammad Al Fayyadh. Doctors, thank you for being with us.
Thanks for having us.
Thanks for having us.
Let's jump right into it. First question, what is prolapse?
So prolapse is when the organs in your body drop from the normal position. They can, drop far enough that they protrude through the vaginal opening, for example.
Or similarly, the rectum can be prolapsing as well, and that would be protruding through the anus, and that would be called rectal prolapse. And collectively, they are all called pelvic organ prolapse.
What causes prolapse in patients?
So prolapse is caused by weakening and stretching of the muscles and the ligaments of the pelvic floor, and that typically results in pelvic organ prolapse.
Yeah, probably the number one reason this happens in women is childbirth. The being pregnant and vaginal delivery creates an injury basically to the support structures of the pelvic floor that over time with gravity and pressure and things like that can result in prolapse in a lot of women.
What can cause your pelvic floor to be weakened?
The largest contributing factor is childbirth. There's genetic factors and things like that as well. By the age of 60, almost 1/3 of women will have some type of pelvic floor disorder.
And also, long-term constipation can be a cause for prolapse, as well as straining and heavy lifting. And pelvic organ prolapse is more common in women, but really it can happen in men or women.
What are some treatment options for someone who is diagnosed with pelvic organ prolapse?
If it's mild, it can be treated conservatively with pelvic floor therapy or with devices called pessaries that can be inserted into the vagina to provide support. But when it becomes more advanced, for example, when it's bulging through the vaginal opening, typically your best bet's going to be to have surgery to repair it.
And definitely if it's to the level that there is full thickness rectal prolapse where the rectum protrudes through the anal opening, it's definitely have to be repaired, because at that time the recurrent prolapsing of the rectum will weaken and damage the sphincter muscles for the anus.
What is a multidisciplinary approach and what are the benefits?
Multidisciplinary approach is basically having two specialties that work together to take care of you.
Yeah, there's a lot of overlap between rectal prolapse and pelvic organ prolapse. Most women who have rectal prolapse also have, either the bladder or the uterus or the vagina prolapsing as well. So, it saves, you can have one surgery to repair both problems. That's one recovery, that's one hospital bill, that's one time off of work, for example. So
absolutely,
there's a lot of benefits to the combined approach.
What are some of the symptoms of pelvic organ prolapse?
So, women with pelvic organ prolapse have voiding difficulties or difficulty emptying their bladder. They can have difficulty with having bowel movements. They can have sexual difficulty. They can have difficulty leaking urine. It can really affect a person's life and self-esteem.
In terms of defecatory problems, having a bowel movement, it would be very difficult, if you do have a change in the angle of the rectum. And that can include, changing positioning when you are having a bowel movement and doing other maneuvers to just have a bowel movement. And that can be a sign that you do have pelvic organ prolapse.
And last, can you explain the surgical treatment process for pelvic organ prolapse?
So the surgical treatment, what we use is a robotic surgery, which is a minimally invasive approach and can provide a very faster recovery and a very solid repair compared to traditional methods.
Yeah, I would agree with that completely. Our patients tend to do very well with robotic surgery. They tend to bounce back very quickly, and we tend to have very good results. So.
Dr. Hulse and Dr. Al Fayyadh, thank you again for being with us. This has been Ask the Doctor, presented by your friends at Northside Hospital, Cherokee.